Do you still think about HIV? Do you think HIV is still a problem? What are the latest rates of HIV infection in the United States and in the world? Are we meeting our goals when it comes to zero HIV 2030? Should you still be concerned about HIV? Isn't it a thing of the past? Wait till you find out the information we have for you today. What you should know about HIV. Are you HIV possible? Do you know what that means? Do you know your status? Do you know the status of your partner or partners? How do you date when you're HIV positive? Well, don't you worry. Dr. Adeyiga, an infectious disease specialist, is myth busting and silence breaking with us today. We thank you guys for watching, and don't forget to do it. Click subscribe. Today, we're so excited to have with us Dr. Adeyiga, who is a specialist in infectious disease. She is here to share with us the important updates when it comes to HIV. Dr. Adeyiga, we're so excited to have you with us today.
Great. Well, thank you so much, Dr. Moore, for having me. Thank you for this platform. The work you're doing in the community, really needed and much appreciated, and certainly an honor to join you today. So of course, we have this Day of Remembrance, World AIDS Day. And as I'm sure many in the audience know, and of course you know, this was first observed in 1988. It was started by two World Health Organization public health officers. It, started as an International Day for Global Health and observed yearly, a day of remembrance, solidarity, and a day for us to reconnect and recommit to our goals that we set for really eradicating HIV/AIDS. So where are we in that program? What's the status update? Well, I will say that in July of 2024, UNAIDS released a report really giving a progress update about the goal that you opened by sharing, which is really the goal to eradicate HIV/AIDS by 2030. And while that goal still remains attainable, we are definitely behind on some of the benchmarks that were set for us to achieve that. And so let me just say there has been progress. For example, in 2010, approximately 47% of individuals living with HIV worldwide were receiving treatment, whereas now that has increased to more than 75% of people who are living with HIV receiving treatment. So that's progress. However, there are new infections rising in several regions of the world, and in particular the Middle East and North Africa, Eastern Europe, Central Asia, and Latin America. So these are things that, we are highlighting because they deserve attention. They need to be focused on. We need to make sure we have the resources available, for meeting these needs. And, in terms of eradicating HIV/AIDS, there's, a few different approaches that are needed, for that to occur. Of course, getting everyone onto treatment who is living with HIV is a vital part of that process. Preventing new infections is also a key part of that process. And there's a lot of research in that space now. How can we best prevent new infections with modalities such as PrEP? And I'm sure we're going to talk about that, I'm sure, later in this session. There's also a lot of effort and interest and, focus in developing a vaccine for HIV and also developing an actual cure for HIV. Right now, it is, of course, an illness that can be managed successfully. People are living long lives who are HIV positive as long as they're taking medicines daily, so-called antiretroviral therapy. So thankfully, it is no longer the certain death sentence it was for so many when the illness first came, online. But even with that said, there's still interest in how we can cure those who are living with HIV from actually having chronic HIV infection. So several different components are included in this goal for eradicating HIV/AIDS. We're behind in some areas, but we've definitely made progress. And just this is the time to recommit to that, to that goal of really negative or, eradicating HIV/AIDS by 2030.
I always say don't let HIV get in the way of love. And so for me, I'm also not the girl who's gonna wait because my biggest fear is falling in love with somebody who's not good in bed. I ain't got time for that. I ain't got time for that. I'm sorry. Get somebody else to do it.
Right.
Because
that's that communication. We here. Like, I gotta know that we're sexually compatible or we not pass and go.
Enlighten us on why we're seeing a resurgence of HIV in certain communities. Have we forgotten that HIV exists?
I don't know if the whole community at large would say we've forgotten about this. I will tell you in the medical community, the passion is still there. People are still working hard in all of the areas that, I just mentioned. I think that, understanding how these new infections are still occurring and how we can deploy tools to prevent that from happening is really important. It's great that we have medicine that we can use to treat people so that, people are able to live long and healthy lives. But we really still want to prevent people from getting new infections. And, I don't know that I would say we've forgotten about it, but perhaps, we need a reboot or rethinking about how we can deploy the tools that we have to really prevent new infections.
And one of the key tools that we have currently that is really reducing rates or new cases of HIV is using PrEP. Can you share with us what exactly is PrEP and who should be considering PrEP? Because oftentimes we think of the LGBTQ plus community alone, but perhaps there are other communities that should be considering PrEP as an option too.
Yeah, that's a great question. So first, let me, talk about, PrEP, pre-exposure prophylaxis, in particular, when it comes to HIV infection. And so, we've learned that actually taking a medicine regularly can reduce your risk of acquiring HIV infection. And this is really a phenomenal tool.
I'm on PrEP because I like having sex sometimes without condoms, and I don't want to acquire HIV. So the only side effects I've had for me with the injectable is you have soreness at the injection site, per usual. I may have like a slight headache, but that's it. I get my shot, I forget about it, and I go about my business.
You have to get tested for HIV every time they give you the PrEP?
So yes, there's something. One thing I like about going to get it every other month is I also get an STD panel and an HIV test. There's a daily pill, and then there
once a day.
once a day, and then there is an injectable. So daily pill is kind of like the birth control you got to take at the same time every day for the most of it.
Okay.
Any kind of person, any kind of sexuality, any kind of gender identity, everybody can.
For everybody. A lot of people, when I tell them I'm on PrEP, they automatically assume I'm positive. They don't know that PrEP is preventative.
Yeah.
And it's not something you take after the fact.
We have, methods that we can explain and, advise people to undertake so that the risk is reduced. But sometimes these methods are not available to everyone. And so we're just, again, looking at all the tools we can use and deploy, so that we can prevent people from acquiring new infection. So again, pre-exposure prophylaxis or PrEP. The idea is that if you are someone who is at risk for acquiring HIV infection, this tool, taking a medicine daily, reduces that risk. Now, who is at risk for acquiring HIV infection? Well, I know we're going to talk about this I Am HIV Possible, which I'm learning more about, but really, there are several ways that have been documented as, how HIV can be transmitted. If you are sexually active, you can acquire HIV infection. So, and sexually active, whether it's vaginal sex, whether it's anal sex, whether it's oral sex, you can acquire HIV infection. Of course, we've also seen infection transmitting from mom to child. We are thankful that those rates have really dramatically reduced in the United States in particular. And there's been efforts worldwide to really reduce that from happening. Blood transfusions. This is a risk that is really almost non-existent at this time because of the rigorous screening that is undertaken, for people who, for blood products rather, who are made available to individuals who need transfusions. Occupational exposure, and if you are sharing, equipment for injection for a variety of reasons, and often we think of individuals who use injection drugs as sharing needles with someone who also may be HIV positive, but, just using that term, sharing injection drug equipment, it really just broadens it so that we can really think about everybody who we should catch in terms of who can be at risk for acquiring HIV infection. And so, in times past, it may be that, well, you may be thinking only if I'm in this particular community, or only if I engage in this activity, is this something I need to worry about? And really do want to shift our mind in that, from that paradigm, because honestly, if you are sexually active, you're at risk. And there are particular scenarios where, the risk is higher. For example, if you are sexually active with and your partner is a person who may be at more risk for acquiring HIV infection for a variety of reasons, then you are now at risk. If your partner is HIV positive and not so-called suppressed, so HIV positive, but not the virus is still present in their bloodstream, because they're not on a regimen that's suppressing that adequately. Now, you being active with that partner, you're at risk. So several categories of individuals are at risk, but broadly, I've explained those categories already, and I want to emphasize if you're sexually active, you are at risk of acquiring HIV infection.
One of the things that I've noticed that has been trending that you just mentioned was HIV Possible.
I absolutely love this medicine because if you are not HIV positive, you are HIV possible, meaning there's a possibility that you can contract HIV.
Mm-hmm.
And to an extent, there still seems to be a stigma when it comes to HIV. And yet there are populations that are overrepresented in the new cases of HIV, like Black and African Americans. And so there is an effort to try to change the stigma and allow people to be responsible, unapologetically responsible when it comes to their sexual health by claiming that they are HIV possible. And with that, taking the steps to protect themselves. So what do you think about the trend of HIV possible, especially when it comes to the Black community?
Right. And it's really, thank you for, highlighting this effort. I want to mention that in the United States, we have seen, a decrease in estimated new infections. But as you mentioned, HIV continues to be, disproportionately impacting certain populations, in particular racial and ethnic minorities, and gay, bisexual, and other men who have sex with men. The highest rate of new infections continue to occur in the South. So this, I am HIV possible, and again, I'm learning more about this. It is a really great effort. This is, through the Black Women's Health Imperative, or BWHI. That organization has several signature programs, and this I am HIV possible discussion falls under this OOOT, or our On Our Own Terms signature program, which really focuses on the treatment, prevention, and care of people living with HIV in particular who are Black, cis, and transgender women. So I am HIV possible really is taking ownership over the possibility that I'm human, I'm sexually active. This means I could become HIV possible, or I could become HIV positive because being sexually active is a risk. And one thing that I observed as observe women having this conversation, who are taking PrEP, and Black women who are taking PrEP, cis and transgender women talking, among each other about, their decision process and how they engage the healthcare system, to obtain PrEP. So one thing that was emphasized is the H in HIV, which is human, and acknowledging that we are all human. And that means that, we all have challenges and struggles, but also we're vulnerable. And, so the women who were talked about, acknowledging this vulnerability and really wanted to take ownership over, their health, and acknowledging, that I'm sexually active. This means I'm at risk. And I really want to reduce that risk as much as possible, understanding that, I'm in a community where this is disproportionately impacted. Because of the data that we have in terms of what type of PrEP can be used and which population of patients, every type of medicine that's available is not going to be indicated for, every group of individuals. Anyone who is sexually active, the CDC recommends that if you're sexually active, no matter who you are, you should be informed about PrEP. Now, who is at risk? I talked about some of those groups earlier, but, understanding how you may be at risk and wanting to reduce that risk, hopefully this is a conversation, if you have talked about your sexual health with your doctor or other healthcare provider, if sexual health was a part of that discussion, then hopefully also PrEP was explained as a, tool that's available. And, with that being said, depending on your risk and which, category of patient you are, there are going to be several different medicines that could be offered. And it is a discussion, with your doctor or your healthcare provider that, this is something that either, we really, encouraging you to take, or, hopefully, if it's not something that your healthcare provider necessarily has, strongly recommended, if you are interested, feeling empowered to bring that up with your doctor or your healthcare provider, and being able to explain what your concerns are. And again, if you fall under the categories that I mentioned, this is a tool that's available to you. So definitely encourage everyone to make, use of that.
Right, exactly. I completely agree with you. And I'm glad that you brought up the point that there are some women who have shared their challenges with navigating the healthcare system and being able to obtain PrEP for themselves.
So I've been on and off PrEP since 2018. I've only gone off PrEP because I move around a lot. I'm an educator. I'm constantly going to wherever I can go to get the best paycheck. Okay, which is nowhere in education if we're being real. But your girl is trying. And so I remember that first appointment, this doctor said to me, well, are you a sex worker? When I told her that I wanted to be on PrEP. And I was like, well, no, I love the girls, but no, I'm actually in a committed partnership. Honey, sex work is work in here.
Yeah.
And so for me, it didn't bother me, but I was wondering, what is it about PrEP and what doctors and medical professionals are thinking about PrEP that says you need to either be a man who has sex with men or you need to be a sex worker in order to take this preventative step. And so I ended up having to spend a couple of hours navigating and negotiating and having this conversation. I have a PhD. How many other Black women feel comfortable arguing with a doctor?
Right.
And so it definitely sounds like there's still a learning curve, even within the medical community, in terms of reducing those biases, sometimes overt, sometimes implicit biases when it comes to who should be offered PrEP, or having that discussion and making it less of a sort of filtering system, but more so a universal system where everyone has that conversation who are sexually active or who are planning to become sexually active. So I'm just want to emphasize the need for advocacy sometimes, and not being frustrated with the healthcare system, because there's still a learning curve and we're still doing work when it comes to biases within the healthcare system. So encouraging those who are interested in PrEP to continue to have that conversation and pursue that conversation with your healthcare provider. One of the things I wanted to do was to give people a sense as to what they can do in terms of knowing their HIV status. Should I be tested? How often should I be tested? Can you give us some insight as to what is sort of the standard of care when it comes to HIV surveillance and testing, so that we know whether or not we're due to be tested for HIV?
Sure. Great question. So in general, encourage everyone to see their doctor, for regular physicals, and including in that physical an HIV test. And, just as a standard, having an HIV test as part of your yearly physical. Certainly if you are, going to enter into a new relationship, it's really, I think, healthy to have that conversation with your partner, and perhaps, being tested together, and discussing this in an open way. Certainly, if you have any symptoms that are concerning for new HIV infection, and what might that be? If you, feverish, chills, new rash, headache, sore throat, fatigue, especially if you were recently sexually active and it was a encounter that may have been one that was elevates risk, and in particular, a person who is HIV positive who's not on regular treatment and not suppressed, or status unknown, or a condom wasn't used, things like this. So in general, for screening as a part of your regular physical checkup, if you're sexually active, for sure, you should include in that an HIV test. And certainly if you have symptoms suggestive of a new infection. If your doctor is provided, or your healthcare provider is prescribing PrEP, you will need to see the doctor regularly for regular tests to make sure that you haven't acquired new HIV infection. So there's definitely a schedule for that if you're taking PrEP. And really, those are the general scenarios that I recommend people have, HIV testing happen. And, in this day and age, we are 2024. I really, want to encourage everyone to know their status. What's your HIV status? Knowing your status. There was a time that, as the illness first came online, this is something that was heavily emphasized among particular groups. But really want to encourage us all to embrace this as all being human, and everyone, knowing their status. If everyone knew their status, this is also a big part of us getting people onto care.
Everyone who's pregnant will get screened for HIV during their pregnancy. Also, an encouragement for people who may think that they are pregnant and they are known to be HIV positive. It's so important to get in and start your prenatal care early. The earliest we can assess your viral load, the earliest we can assess your CD4 count and determine what is the best antiretroviral medications for you, the better the outcomes. It is possible to have a very safe pregnancy and to minimize the risk of vertical transmission, which we've done so well in this country, and we hope to continue to do the great work. But part of that is exactly what we're discussing today, which is being informed and being proactive about your care. I mean, when we think about it, people share just about everything nowadays on the internet, on the social and the media, right? All the intimate connections we are seeing on social media, the bedroom tales, the bedroom secrets, and then some. So we want to make sure that we're also having these responsible conversations as much as we're having some of the other conversations and exposures. So that people feel that it is a standard conversation and doesn't feel stigmatized about having an HIV conversation, making it no different than having a conversation about your blood count, to having a conversation about your renal function, right? That's really the goal in order for us to get to that 2030 goal.
Absolutely.
And so one of the things we also want to remind people about is U equals U. So some of you may have heard U equals U, but may not quite understand what that means. Can you enlighten us? What is U equals U?
Sure. For U equals U, so we've learned that individuals who are HIV positive or people living with HIV who are taking medicine to suppress the replication of the virus, so are on antiretroviral therapy and undetectable, individuals in this category do not transmit infection to their partners. And so this is another reason why we're really very much wanting to get everyone onto treatment and get everyone suppressed, because this is also a key part, in reducing the rate of transmission and, really, getting to that 2030, eradication goal. So this is U equals U, undetectable equals untransmittable.
And that is so encouraging. I mean, I think it's encouraging to
Absolutely.
know that if you take your medications, you see your doctor regularly, you can get to the point where you can have an undetectable viral load and protect your partners or potential partners. So that's oftentimes a hard discussion that people have with their partners is, how do I disclose to my partner that I'm HIV positive? So what advice would you give to someone who may be having that challenge and still doesn't feel quite comfortable talking about their HIV status? How do we have that conversation with potential partners?
There's probably not a one size fit all for every person or every patient. Now, for a person who is, entering into, you're dating and you're HIV positive, I think that, let me just say, I'm not a dating coach, so I can't necessarily give you dating advice, but, hopefully it is encouraging to know that U equals U, so you feel comfortable even entering into the dating world, understanding that I'm taking my medicines, I'm taking, responsibility for my health. I've, taken regular medicine such that I'm undetectable. And so in this way, hopefully you feel confident in engaging in the dating space and not feeling as though you're going to be a risk or a burden to your partner. And I often counsel patients who, have questions about this and other sexually transmitted infections, where they may have a partner at risk, it really, and so I'm talking about first a category where, you're wanting to enter into a long-term relationship with someone, a committed relationship, especially when there's love involved, partners can be very accepting of this. And I've, also offered to, have people bring their partner into the office in case, their partner wants to ask questions, with the person who's my patient, if they feel comfortable doing that, or if the patient thinks that can help. In relationships, as we build, trust and partnerships with people, it takes time to build trust. And so, this is an important part, that's an important part of building trust, having a conversation with people, but also feeling comfortable and confident knowing that I'm taking medicine. The risk of me transmitting is, undetectable equals untransmittable. I'm going to always encourage people, if they're sexually active, to use condoms. This is going to reduce your risk of transmitting or acquiring. So continue to do that. And I'm going to say that the priority is, of course, on your health. And so that means seeking out care. If you're HIV positive, seeking out care, taking your medicines. In that space, hopefully you feel confident and encouraged entering into the dating space.
Absolutely. And I love that you said to bring your partner into the office. We bring partners into the office to talk about preconception care. We bring partners into the office to talk about herpes. We bring partners in the office to talk about also cancer diagnosis.
Absolutely.
So HIV should be on that list as well. I like the thoughts of couples coming in for care together. I think it's empowering. I think it's encouraging. And I think it breaks the silence for some of these conditions that are so much harder to talk about, only because the uninformed creates the stigma. The informed reduces stigma. And so I love the fact that we're encouraging people to bring their partners into the office. And there are communities out there, and there are communities that are sex communities. So making sure that you take precautions, use condoms all the time is what we recommend, to use condoms so that you're protecting yourself, those who are participants in the sex communities and in the sex industries as well, taking on as much responsibility as you can for your own care. So if we were to leave you with just a couple of action points. So what are some actionable items you can share with the community if they're wondering, what can I do right now today?
I would say, if you don't know your status. That's the first important thing you can do. Get an HIV test. Second, learn more about PrEP, especially if you are sexually active. And the CDC website has great information to, inform you about this. And so you hopefully now feel empowered to bring this conversation up with your doctor if it hasn't already come up. If you are sexually active and you're concerned, bring it up with your doctor. This is something that I learned about, but you didn't already know. Tell your doctor, this is something I learned about, and I really want to, consider this as an option for me. What are your thoughts on that? So 2 actionable steps: get HIV tested if you don't know your status, and learn about PrEP. The CDC has great information about that.
I love it. I love it. I love it. Oh my goodness. And if people were to want to find out more, you mentioned the CDC, anywhere else that they can go to find out more information about HIV and the zero goal for 2030?
This Black Women's Health Imperative has actually, and this I Am HIV Possible initiative in particular, there's a search engine I saw on the site where you can look to see where you can get PrEP prescribed. Of course, LA County Department of Public Health, and the California Department of Public Health also, has information that you can learn if you're worried about, things in California in particular. The CDC is, national on a national level, and of course the WHO on a global level if you're worried about it. If you are, have families in different parts of the world, you can learn more about the status of things in your particular, in a particular country of interest.
Yes, I love that you mentioned the WHO because we do have an international audience. So we recommend that you use that as your resource when it comes to world statistics and initiatives. And yes, I love the Black Women's Health Initiative. They're doing amazing work. And this is one of their more recent initiatives that I'm just so supportive of. And I'm so excited to see that they're taking the lead in that space, given the fact that we are disproportionately represented when it comes to new cases. So keep in mind, HIV is still acquired in heterosexual relationships and encounters. And I think that's one of the false information that it's only one particular community. We're trying to break that and make sure people are aware because it's oftentimes taking people by surprise when they find out that a heterosexual Black female is HIV positive. Okay. All right. So that being said, we thank you guys for joining us. First of all, can we just, before I even close out, can we just give Dr. Adeyiga a round of applause for just all that knowledge, all that insider knowledge, broke everything down for us, okay? Step to the depth, okay? We're so excited when we see people who look like us, who talk to our communities about these important information, because oftentimes we feel like when it comes to medicine, that we like to see people who we can relate to, who understand our culture, our mindset, our historical issues when it comes to healthcare. So it's so important to see that we're in these specialties. So we thank you so much for hopping on the virtual couch with us and sharing all of these important information. So I am Dr. T, the hand behind the handle of Healthy Bum Club right here on YouTube and on Fanbase. Don't forget, we support our own. And if you're done here, make sure you hop on over to healthybump.club on Instagram. We thank you guys for watching, and we hope to see you guys when the next episode. Don't forget to comment, like, and share.